We've got Montgomery County is represented this morning by Teresa Russell. I've known Teresa for a few years. She really does some hard work, and she's about to tell you about how their program evolved and what they do. Thank you, Teresa.
Sure. I'm Teresa. I am the Director of Criminal Justice and Outreach Services in Montgomery County. I work for Sheriff Rob Streck. I actually came to Montgomery County in 2017 under the former sheriff, who is now a state representative, at the height of the opioid epidemic. And I was tasked with one thing coming in the door, and that was developing MAT, right? So again, and we're sitting here today in 2024, everybody's had this experience. Sure. Had this experience with, the people who are coming into the jails, coming in, you detox them, then they walk right back out and face overdose if you don't have wraparound services. So I could not come in and develop MAT services without having planning around reentry. So I want to talk for a minute about statistics, and I pulled this off the SAMHSA website last night. It looks like there's an estimated 44% of individuals incarcerated in county jails have mental illness. That pretty much matches the population in my jail of people getting psychotropic medications every day, right? So on top of that, we estimate that 63% of those people in jails, 58% in prisons have a substance use disorder, right? So again, I came in 2017 looking at a very specialized population of people. But reentry is important for everybody. Everybody needs reentry services. So we're going to talk about exactly how we develop that in Montgomery County. But for Montgomery County, this was huge. And these statistics were important because clearly Montgomery County, unfortunately, was known as ground zero for a national opioid epidemic, right? In 2017, we had the most deaths per capita. This is why it was super important for my sheriff to say, I need somebody behind the walls that's willing to do Vivitrol, right? I need somebody who's willing to do education and all of these wraparound services. And we had tons and tons of community providers that said, we want to do it, but oh my gosh, we can't get paid for it inside the jail, right? So how are we going to do that? We looked at reentry services with three legs: a formal discharge planning service, peer recovery services, and how to enhance community partnerships. And a lot of this is going to sound repetitive to what Franklin County just stood up here and talked about. But discharge planning was key. Coming in the door, my thought was, discharge planning for somebody incarcerated should look like a discharge plan for you and I leaving a hospital, right? It should say, why were you here? What medications were you on? What's your next appointment? Where do you go? What's your insurance status? All of those good things should be included in discharge planning. So let's talk about discharge planners. I lobbied, I said, this has to be robust. So I went to my sheriff, who then went to our county commissioners, who said, we want to basically wrap the idea of having discharge planners into our correctional health care contract. So we asked for 3 full-time discharge planners. At the time, pre-COVID, even though Montgomery County has a population half the size of Franklin, we were booking in between 23 and 25,000 people a year. I can tell you right now, 3 full-time discharge planners are not enough. 3 full-time discharge planners are still not enough for the 17,000 people we're processing post-COVID. That's why having community partners are important. And peer support. I'm going to hammer while I'm standing up here on peer support services. Ohio's ahead of the game. Yeah. We really are. When it comes to peer services, I got to present at the National Sheriff's Association last fall and went in strictly talking about peer recovery programming in jails. And all of these sheriffs were like, no way. There is no way I'm giving somebody with a felony background and in recovery keys to my facility. And I had sheriffs walking up to me afterwards saying, oh my gosh, I'm a believer. And thank goodness for sheriffs like Sheriff Katusian from Middlesex, right? Because he'll stand up there and tell you, you have to have these navigators. You have to have these people who have lived experience that get up and help. For me, coming in 2017 saying, hey, I want to develop MAT services in this jail, I don't have any lived experience. I can walk through that jail every single day. I have no credibility. I'm seen as a figure of authority. My sheriff comes in, he walks every Friday. The inmates will talk to him, but not about their needs, right? But they will talk to people who have been where they are. So those peer recovery specialists are key. And again, I'll come back to them. But discharge planners. So I wanted a full discharge plan, something that was completely comprehensive, that identified everything that somebody needed. How does someone get a discharge plan? Was it only solely for somebody who had MAT? No, because it needs to be available for everyone. So we developed a system where a discharge planner, you could get discharge planning services one of three ways in the Montgomery County Jail. You could ask for it. You could put in a kiosk request and say, I would like to meet with a discharge planner. We advertise through our kiosk system. We advertise through our jail TV system about discharge planning. We see discharge planners walking through, inmates. We have what I call inmate.com. They'll say, who is that? What do they do there? They'll ask their other people in their housing unit. They'll ask the corrections officers. That's a discharge planner. They'll say, I want a discharge plan. So the discharge planner will come and see them within 24 hours, right? The second is a court request. When discharge planners got ramped up in 2018 and probation officers learned we had discharge planners, they thought, ooh, this is gonna help me a ton. And it does help them, and it also kind of keeps them from, an inmate saying, I need discharge planning, and getting something set up, and then the court turn around and setting up something totally different, right? So they do communicate with probation and parole officers. But more importantly, one of the things that we said was, these people come and rotate in and out so fast. We are now at 82% of our population are felony offenders. They're still out of that jail, and average length of stay for them is still 6 days. 3 days for misdemeanors, right? So again, people are coming and going really, really quickly. So what happens is every Monday, my population manager sends out a list of people who have been sentenced to the Montgomery County Jail. And if you're within the last 30 days of your sentence, a discharge planner is going to come and see you regardless. So they're going to come up and they're going to say, hey, where are you going when you leave here? And if an inmate says, I don't need anything, I'm good. Like, I've got all my needs are covered. They come up there ready to talk anyway. They come in and they say, well, I've run your insurance status and it's not active, right? So we can do an application for you today. At least you can leave with an application number. Where are you gonna live when you leave? When you came in, you had to detox. These were the substances that you were dirty for. Who's gonna continue your blood pressure medication? So they engage them in conversation based on what they know. And because they're part of that correctional healthcare vendor, they have access to the entire electronic medical record, right? So they're looking at those things before they go and see someone. If they still refuse discharge and planning services, they've refused them, that's okay, and that's their right, but it was at least offered. So one of three ways, that's it. There is some special consideration given to inmates who are high utilizers of service. We'll come back to that also because we have a couple of initiatives in Montgomery County that help us identify what we call familiar faces. So those familiar faces kind of get fast-tracked to discharge planners to let them know, here's somebody in custody who is utilizing a lot of services in the community, especially the hospital systems, the homeless shelters, things like that. Discharge planning is not done by peer supporters. They're actually done by what I call case managers. So our discharge planners are skilled case managers. They usually come from behavioral health care backgrounds. They understand the community programs that are out there. But we are huge utilizers and supporters of peer support. Again, these are the people who have lived experience. If I walk through that jail and I walk up to an inmate and say, what is it that you need when you leave? They don't want to tell me. Sometimes they will, but it won't be as in-depth as it is for somebody who's already in recovery. Peer support fields a lot of those referrals to discharge planners. So we do not ask peer supporters in our jail to be case managers. We want them there just to be somebody with lived experience who understands what they've gone through and can help them kind of navigate, but not actually do the case management work. Let the case managers, let your discharge planners stay in their lane, and let peer supporters be those cheerleaders for those people. Just like you wouldn't want a peer recovery person trying to offer legal advice, right? So you don't want them being part of the discharge planning process in regards to helping set that up. But they can definitely make that referral. I mean, they're usually the first point of contact when they're talking to inmates to say, have you talked to a discharge planner? You know, you can put that referral in through the kiosk, or I can help you do that. Discharge planners also come and meet with everybody regardless of what their stage of change is, right? It's kind of like peer support. Super frustrating. One of the things that our discharge planners get the most frustrated with was, Bobby, we just did a discharge plan on you, 30 days ago, and you're already back in jail on a probation violation, right? It's that stage of change. And until we brought peer support into the jail, working with discharge planners, did the discharge planners really get that, sometimes we're setting up these services for people who really aren't in a stage of change, right? They might be pre-contemplating where they need to be. So they've been a good support for each other, I think professionally, peer support with discharge planning. But either which way, they are two very distinct but very important supports for your inmates. Again, 3 discharge planners, 2 peer support specialists assigned into Montgomery County Jail. Nowhere near enough for thousands of people who are coming in every single year. So what we did was we set up MOUs with various agencies to help us follow up with people upon release. Again, this went all the way back to starting with the people who signed up to be part of MAT programming. So I wanted to know that this was helping, right? So in the first 2 years of starting Vivitrol release program, I was like, how do I track recidivism? How do I track if this is working? Like if discharge planning helped, if they followed through with MAT. So I very, very, very heavily depended on some of the outreach agencies in our community to do follow-up with those people. So literally, if a discharge planner set up an appointment for somebody to follow up at a community behavioral health agency and they didn't show up, we didn't have the manpower through the sheriff's office to go knock on doors. But there were tons of agencies that had grants and other peer supporters and community outreach specialists that did. They went and knocked on doors and said, hey, you didn't make it to your appointment. You said you didn't need transportation when you left the jail. What's going on? Let me help you get you set back up. They come to the jail. They pick those people up now. They take them. So we're not using as many of our deputies for courtesy rides anymore like we were. We have 5 agencies now that we work with through MOU at no cost to us. And that's probably one of the greatest benefits when you look at how to fund services. A lot of nonprofit agencies are going to get grants before the sheriff's office does, unfortunately, right? But they're going to get opportunities for those grants, and they're going to want to partner with you. They love to partner. They call me all the time. What do you need? I need outreach. I need somebody to go and follow up on 17,000 people this year. And at first they go, ooh, I don't know. But it sounds good, and it's going to look good on paper, and I'm going to apply for it, and let's see how it works, right? And they do. They really, really do. Again, probation and parole. One of the initiatives that we have through our sheriff's office is called GROW, Get Recovery Options Working. GROW started with a woman in Montgomery County who her daughter was frequently overdosing, and she started Families of Addicts, FOA, which has branched across the state of Ohio and to other areas. But she was constantly calling because she wasn't sure who to call for help, but she would call the sheriffs. We would go out and work with her. And when her daughter got into recovery, she became a certified peer recovery specialist. And through GROW, we have a peer supporter who every once in a while will go out with a deputy and treatment provider, and they'll go and do overdose follow-ups, right? This is part of our diversion tactics. Like, we want to keep people from coming into the jail. Little sidebar from reentry services. But this kind of grew some momentum with probation and parole. Probation and parole took the model for GROW and said, hey, not only just following up on your people who have had overdoses, but some of our offenders who just got put on probation and parole. Like, will you go out and check on them and see how they're doing? Because if we show up with probation and parole on our back, they're not opening the door for us. Sometimes they don't open the door when they see the deputy, but when they see that peer supporter, they open the door, right? So that's been great, because that's been another part of that community partnership where we can go out with our outreach teams and say, hey, you had a probation appointment on Tuesday and you missed it. Are you doing okay? Like, what do you need? What's happening? We don't want you to come back through the jail, right? And our public defender's office, about 3 years ago, the public defender's office got a grant. They started what's called a holistic defense team. Those are complete wraparound services for our people in and out of the jail. They put, again, some special emphasis on our people with significant mental health issues, especially our people who end up going to Summit for competency restoration. They follow what goes on in the jail. They're part of that discharge planning team. If they have to go down to the state hospital, they're part of the treatment team planning there. And they are the people who actually hold those offenders' hands through processes, right? So when we have our population of people who have significant mental health issues, that was one of my biggest pet peeves coming through the door. I worked in community behavioral health for 25 years before I went to the sheriff's office. I spent 4 years working at Twin Valley. I was there when the doors closed. I knew you can do a discharge plan for somebody with a significant or with a severe and persistent mental illness. You can give it to them all day long. If you do not hold their hand through the process, they are not going to go. They are not going to show up. They're not going to follow up. We have a lot of frustration on law enforcement is frustrated all the time when we take people to local hospital. Do a pink slip, they're back out on the street. I call the hospital and say, what happened? Well, we discharged them to follow up with services at A, B, and C. But you put them in a cab and sent them home, right? Well, they knew where they needed to go. Okay, so, but unless somebody is actually there to hold their hand through those processes, that is what our holistic defense team through the Montgomery County Public Defender's Office does. They literally hold someone's hand through the process. I had a call last night at 7:30 last night from one of the social workers with the holistic defense team. Said we had a judge in Montgomery County who was revoking conditional release on a defendant who now lives in Kentucky. And he has 10 days to turn himself in. The family was scrambling. They were trying to get him up to Montgomery County Jail last night. He has a slew of medical issues, onset of dementia, some other problems. But this woman, who is the social worker, is working with the family to make those arrangements to get him here and then get him tucked away at the state hospital where he's supposed to be. Again, these are things that are outside the scope of roles and responsibilities of a jail discharge planner, but jail discharge planning is so dependent on that information and those partnerships with probation, parole, our peer supporters, and now this holistic defense team of social workers who work with the Public Defender's Office. ADAMS board, or some of us call it the ADAMS H board, right? We run 2 separate roundtables in our county that supports reentry. Through ADAMS, we do what's called familiar faces. Again, familiar faces is our people who are, they're high utilizers of service. They're in and out of local hospital. They are in and out of your local treatment facilities. They are in and out of the jail, right? So this is the chance for everybody to come to the table once a month and staff who those familiar faces are and what services do these people need, again, as a diversion effort to keep them from coming back into the jail, to keep them from going back into the hospital, and just make sure everybody's on the same page with what was the discharge plan for somebody who left the jail. So again, you want that information shared. We share our discharge plans with the court. We share our discharge plans with our local ADAMS H board, with all of those providers who sit in those roundtables. And then our Montgomery County roundtable is a monthly team meeting. That is heavy with law enforcement. So in Montgomery County, we have 28 arresting agencies. So we bring pretty much a little bit of everybody to the table because a lot of our people are transient, right? They're going in between the districts. They're going in between the townships. Everybody's working with the same people. And again, this kind of keeps everybody on the same page. So when those familiar faces hit the jail, discharge planners know, all right, this is somebody who's already linked to this behavioral health agency. This is somebody that the homeless shelter or the homeless system has already been working with. One of the points that Ryan brought up was how important ODJFS is in some of this, right? So in Montgomery County, our Adamus Board funds one position to be an ODJFS liaison for our individuals who are in the jail. So there's no gap. Somebody comes out of the jail, we have a jail treatment coordinator who can actually verify, send verification over to ODJFS that, hey, Mr. Smith has released from jail today, and their Medicaid is temporarily turned on. Discharge planners have put the application in, we've got an application number. They turn it on temporarily so that they can start services that day. We can have our community providers either do the pickup there at the jail and get them taken to where they need to go. But there's literally no bridge or no gap in services because of that bridge. That has been extremely effective and important, specifically for our people who are on MAT, right? To make sure that there is no disruption in services for their needs.
Teresa, can I just ask real quickly,
Yeah.
on your roundtable or your familiar faces, is there a legal component where the public defender and the prosecutor are actually
Yes.
discussing and negotiating?
No, not during the roundtable.
Okay,
There's representatives from each office who attend just
Okay.
to keep track of information.
gotcha.
That way, you know, if they have a defendant that ends up back in the jail, we can say, hey, the roundtable was working on this plan. They had this discharge plan from the jail. You know, sometimes people, you know, we're a county that runs off of client choice, right? So, you know, sometimes people say, well, I want this agency because they think it's convenient or they think it's a good fit. Sometimes it's not a good fit. So at least being able to staff that information in those roundtables, everybody's on the same page of what somebody has attempted and tried and whether or not it's been successful.